to have Nia Westbay and Brian Cole with me tonight for this webinar. It's actually a webinar that's marking the end of my presidency. So this will be my legacy before I move on to the position of past president. And I must say, you know, it's going to be some kind of a relief. There's work that comes with a presidency in the division. This webinar is going to focus on poverty, gender, and parenthood. First, I need to say that there are no conflicts of interest, and this webinar is not supported in any way financially by a commercial vendor. There are 3 learning objectives for tonight. By the end of this webinar, you will be able to describe the effects of economic insecurity on children, youth, and their parents. You will also be able to describe 2-generation policies for helping families out of poverty and how masculinities influence parenting behaviors. I will now introduce our 2 speakers. Nia Westbay holds a PhD in community psychology from New York University, and she's a senior policy analyst with the Center for Law and Social Policy, a national, nonpartisan, nonprofit organization that advances policy solutions for low-income people. I invited Nia for several reasons: because of her work on poverty and also low-income parents of color, and because she came from a different discipline. And what I'm hoping we can also get out of this webinar tonight is to address complex social issues like poverty. We also need to think interdisciplinarily. We need to start working with psychologists across our subset specialties to pull our knowledge together and develop solutions. And I hope this webinar tonight will be an example of what I think should happen in our field. Brian Cole is an assistant professor of counseling psychology. So again, counseling psychology is another discipline in psychology, but not so separate from family and couple psychology if you think of his work. He is in the Department of Educational Psychology at the University of Kansas and specializes in positive psychology, men and masculinities, psychological assessment, and vocational psychology. What's exciting about Brian is that he has developed, created, established the Applied Masculinities and Positive Psychology Lab, and it focuses on the areas of men and masculinities, in particular paternal involvement, mental health, gender socialization, and help-seeking behaviors. And we have a lot to learn about how gender also influences the relationships, family relationships in particular, but also parents' involvement in the parent-child relationship. So this webinar will look like a question and answer. So I will begin by asking questions to our speakers, and they will answer. They have also created slides, PowerPoint slides, that if it's okay with them, I will share with all of you at the end of the webinar, so you have it as a reference. I will now start by asking Nia questions about lifting families out of poverty. And my first question to Nia is, you are a senior analyst at CLASP and a community psychologist working at the intersection of psychology and social policy. Your research focuses on economic insecurity among young, low-income parents of color and strategies to help families out of poverty. Could you say more about your research and your work in the community?
Sure. Thanks so much for inviting me. I'm excited to be here, and thank you to everybody who's joined us. It's great to have folks together on a Sunday night. So I'm going to take that question in a few layers. So first, I want to say a little bit more about CLASP, where I have been working for I'm approaching 5 years there now. So as you said, CLASP is an anti-poverty advocacy organization. We've been around for just over 50 years. And we do our work at CLASP in 6 main policy teams. all focused on different issues that impact folks with low incomes and their families. So we have one team that's focused on income and work support, which is a lot of the public benefits that people think about, like SNAP and TANF. We have a team that's focused on post-secondary education and workforce development. We have a team that's focused on job quality, which is issues like paid family leave and fair scheduling. We have a team focused on early childhood education early childhood education and childcare. We have a newer team that's focused on immigration and immigrant families. And then we have the youth team, which is where I sit. My team is fairly unique because we are focused on a population as opposed to a specific set of policies. So a lot of our work is sort of interdisciplinary and cuts across the different teams at CLASP because so many things impact the lives of young people. And whatever impacts the lives of young people is what we're thinking about. The other things I would say about our work at CLASP in general and on my team specifically is we really try and think about our work with a racial justice lens and a racial equity lens. And one of my favorite things that I've been able to do in my time at CLASP is really think about how to bring young people's perspectives into national policy conversations, which is something that is unfortunately exceedingly rare. And so I have had the opportunity while at CLASP to do that in a number of different ways, but the work that I'll be sharing with you all tonight is based on a number of focus groups that we did with young people all around the country, which interestingly enough, none of these focus groups were designed to be young parent focus groups, right? Like that wasn't the premise when we went in, but we were doing these focus groups on mental health and focused on young women of color and had many young parents in those groups. Sometimes the babies were there with them. And so sort of went back to the data with that lens of like, let's look at what the young parents were saying that's fairly unique. And really found a lot of really rich content that is at the center of sort of the different policy and programmatic pieces that I wanted to share with you all tonight.
So there are some slides here that you shared with us, and I think you wanted to share some of your findings you mentioned.
Yeah, sure. I can walk through what I have. The outline is sort of, we're going to talk a little bit about who young parents are, both in terms of how they define themselves, as well as what some of the data says, and talk a bit about young parents and poverty and sort of what that looks like. Talk a little bit about some two-generation policies, which just to sort of define that term, actually when I first started working at CLASP, a big chunk of my work was a two-generation state policy project, which is really about figuring out how to make our policies work with people as though they are a whole family, as opposed to just the parent over here and just the child over here, and God forbid you try and bring up a grandparent or somebody like that. So there really are some important policy solutions, particularly for young parents, that I'll highlight, as well as thinking about you all in this audience who are not necessarily policy people, not necessarily maybe have given this population much thought before, to really think about what are some things that you all might want to be thinking about in your own practices and research. So, as I mentioned, we did focus groups with young people around the country, and I always like to lead with the words of the young people. So on your screen is a quote from a young person in Alabama who said, "Everybody goes through different things, but I feel like women generally are strong because we deal with a lot of things growing up, especially being young moms, being single mothers. You got to be strong to be able to take it. You have to be strong enough to take it. Not everybody is strong enough to take it." And I lead off with this quote and this point because there's a real need for some narrative change around young parents and who young parents are. For the parents that we talked to, parenthood was very central to their identity. They saw that as sort of a very critical piece of who they are, that it was a transformative experience for them to become a parent, as well as something that was highly motivational. It was something that sort of motivated them to make necessarily changes in their lives, about their decisions, all that sort of thing. And I think what's really important to start with is that when you ask young parents to define themselves, they really have this strengths-based view where they talk about themselves as strong, as patient, as caring, as sort of having developed all these positive traits and assets as a result of becoming parents. And I think while maybe we think about that with older parents or with middle-class parents, these are young parents, all young people of color. We spoke to Native young people, Black young people, and Latina young moms. Those were all moms in those groups. And sort of all of them had this understanding that becoming a parent was really this very important thing to defining who I am and what I'm about, and a positive thing. And so we really need to think about approaching young parents with that in mind. I think the next slide gets into sort of some of the data pieces in terms of poverty in this population. And what we do find is that young parents are much more likely to be living in poverty than young people in general. Folks may not know this. This comes as a surprise to some people, but young adults are actually have one of the highest poverty rates of any demographic group in this country. They are right behind children, or sometimes around the same rate as children. So in general, 1 in 6 young adults in this country, 18 to 25 years old, is living in poverty. But when you look at young parents in that same age range, then that number goes to 1 in 3. So clearly we have a group of folks who are experiencing a lot of economic challenges, right? And young adults in general also report that they experience high levels of serious psychological distress. Now, that's not necessarily clinical diagnoses, but that's sort of the kind of consistent low-grade anxiety, depression that folks get surveyed about on the National Survey of Drug Use and Health. And young adults who are living in poverty report higher levels of this kind of stress, which can impact both their educational and economic outcomes. And young parents, we learned in our conversations, have some sort of fairly unique challenges that come up, and some unique traumas and chronic stress that they experience because they are parents. And those are things like elevated infant mortality rates for low-income parents of color, so we had instances where we heard from young parents about having lost a child, and that's actually a much more common occurrence with that group of parents. The types of environmental stress that a lot of young people living in low-income communities are subject to really get amplified when you're a parent, because the young person is not only experiencing that stress for themselves, but they're also worrying, and rightly so, about the impact of the environment on their child. And we also see a lot of program and policy barriers in the ways that we have set up our systems that serve young parents that actually add a whole nother layer of stress to their lives on top of the different sort of economic challenges and things like that that they're already facing. So we have a group of people who really are facing some sort of difficult and unique challenges based on the fact that they are both young and parents, that it's really important for us to be thinking about.
Can you describe, your group is doing a lot of work trying to find solutions to those issues, and could you describe what you call the 2-generation policies to resolve economic insecurity?
Sure. So before we touch on that, can you go back to the prior slide? So I just want to say a little bit more about what I mean in terms of policy and program barriers that young parents face. And I'm thinking that some of these may end up being having tie-ins to some of what Brian's going to talk about. So a lot of times the policies or the rules that different programs have in place can actually create additional barriers for young parents. So again, I have a quote from a young person, this one was in Texas, who said, because I wanted a water birth and the insurance just doesn't cover that. You have to pay out of your own pocket. Yeah, they were saying things, the Medicaid covered for birth, like I was trying to have one. At first, we were talking about having it in my own place, like a midwife, but that didn't work. The insurance didn't work with a midwife, so I'd actually go to the hospital and give birth there. So this is just one example of the types of things that we're talking about. Now, this is a bigger problem than just young parents, living in poverty, right? There are all kinds of issues in this country with birthing practices and what insurance will pay for. But the particular challenge here is that a middle or upper class woman is more likely to have the resources to just pay for that birth and to get the experience that she wants, versus young women living in poverty, they have to take whatever Medicaid pays for. And there's all kinds of evidence about sort of the impacts of having your birthing choices respected and how that shapes then how you feel after the baby's born and all these other sorts of things. So that's an example from insurance, but there were other issues that we heard about in terms of employment barriers. And this is a piece that I think is probably going to have some tie-ins with what Brian is going to talk about. The way that many of our programs are set up do not support co-parenting outside of marriage. So we heard from the young people that we were talking to, moms and dads, that they all wanted to be invested in their child's life and wanted the support of the other parent in their child's life, right? But so many programs that serve young parents are single gender, where you have individual housing as opposed to family housing, where there are age cutoffs. So if there's some kind of difference between your age and the age of your co-parent, you can't be in the same programs together. And even beyond that, just sort of a real lack of support for modern family structures. I would say the young people are ahead of us, and understand that families look a lot of different ways now, and come in a lot of different configurations. And young people are okay with that. But our programs and policies have not caught up to understand that you may have two people who are not in a romantic relationship, but have a child together and want to do a good job of raising the child together. Let's figure out how we can support that. Or even worse, in some places, have policies that really actively pit the parents against each other, particularly when you're thinking about issues like child support or even childcare subsidies in certain places. These programs really pit parents against each other, where it's sort of like, if you don't put the father on child support, then you can't get the benefit, or those sorts of things. So if we go to the next slide, I can outline a few of the solutions that we've talked about to get back to your question. The things that young parents talked about needing were really sort of positive energy and support in their lives, as well as resources, because so much of the strain and the stress that they experience is financial, that there's really a need for economic supports to meet their needs. And that's really central to think about, right? When you're talking about young parents who are living in poverty, so much of their mental health stress is actually economic stress, which is why economic policies matter for their outcomes. So we want to think about investments in employment and training for young parents. We want to think about access to public benefits, and certainly not creating barriers to public benefits like the ones that I talked about. There have been other issues lately around immigration and public charge and all sorts of policy tools that make it harder for families to access the benefits that they need, where they're already stressed out enough. Like, they don't need the extra stress of getting help be difficult for them. Thinking about our, there are programs like the Workforce Investment Opportunity Act, which actually has a priority for young parents. And they, thinking about how we make sure within our programs that we are supporting parents both as workers and as parents. And as well as thinking about community-wide strategies that can both build social capital so that families are feeling supported by their broader community, and the structural factors that foster community violence. So we know that the environment and violence in the environment is a really important issue for young parents. And to the extent that we can think about policy solutions focused on violence prevention and investment in communities and building up communities to be supportive, that's all going to be helpful to young parents. Oh, Corinne, you're so muted.
Yeah, I'm trying to keep my cat out of the recording. So what do you think couple and family psychologists and practitioners in particular should know about these strategies, or how to help families out of poverty?
Yeah, so I think there's definitely a role for, for this field, because like I said, the mental health needs are great. I think one of the really key things is where I started, recognizing that young parents' role as parents is an asset to be affirmed. We really got to stop with sort of the punitive and judgmental framework that a lot of times gets applied to young parents, because it's just counterproductive and it's not helpful for anybody. Secondly, we want to eliminate those programmatic and policy barriers to co-parenting. So really thinking about how your work is structured and how it supports young parents to build the skills to effectively continue to co-parent with somebody that they're not in a relationship with, or how to work together, the problem solving skills, the conflict resolution skills, all that can be really important. And shouldn't sort of assume that young people don't want to parent together, or that people just want to be single parents or something like that. I think also recognize the importance of choices around prenatal care, birth, and postpartum care with an equity and cultural relevance lens. So I think that, and more broadly, I think for all of you, if you're doing insurance-based work, people with low incomes can't access your practice if you don't accept Medicaid. They just can't. And so, short of being able to change the rules for what Medicaid will reimburse as far as birthing choices and that sort of thing, looking to community-based programs that rely on doulas and midwives and really trying to scale them, thinking about, whether it's pro bono services or volunteering in the community, or how you can provide your services to support young parents in a way that removes that financial barrier for them. And this doesn't become another financial strain of trying to get support and trying to get the help that they need. And then the last thing I'll say is really thinking about being trauma-informed and healing-centered in your work. Many young parents from communities of color, from economically marginalized communities, are carrying a lot of different types of trauma that, they may or may not be very forthcoming with at the beginning. And it's very easy for our policies, our practices, our systems to re-traumatize young people if we're not being really intentional about understanding the types of trauma that young people carry, and what are the different types of supports, whether it's cultural based supports, different kinds of healing practices from different communities that can be helpful. And so really learning about and being thoughtful about some of those concepts, those culturally based practices, healing circles, that sort of thing, as well as really understanding you don't know if a young person has experienced the loss of a child, has experienced violence in their community, is worried about how they're going to pay for food for their child and sort of what that does to their demeanor when they show up. So just really making sure that we're having all of that in mind in our practice and how we're thinking about supporting these young people.
Thank you. Before we go on with our presentation, I just want to remind everyone that you can type your questions in the chat box, and I will go to the chat box and ask those questions for you, and so we avoid muting and unmuting because it can be complicated. Brian, I'm turning to you, and we want to know more about your work as well on masculinities and parenthood. You're a counseling psychologist and an assistant professor at the University of Kansas, where you study men and masculinities. You're also interested in men's family roles and fatherhood in particular. Could you tell us more about your research on fatherhood and masculinities, and what are 2 or 3 interesting findings that we should, all of us, couple and family psychologists and other practitioners, should know about?
Sure. So thank you all for being here tonight. I'm excited to get to talk with you about some of the work we're doing and learn more about the work that Nia's been doing as well. I started off as a men's health researcher, primarily focusing on the ways in which gender socialization influenced men's help seeking for things like depression. And in that process, became a father. And so I had a newborn join my research team back in 2015, and she hung out in the high chair during all of my conference calls. And so she has as many publications as I do now. But I became really interested in understanding what fatherhood looks like in 2020. And so, throughout the course of this time, I've been focused a lot on how endorsement of traditional masculinity helps or hinders involvement, primarily between dads and their infants. And so the work that I do is primarily for fathers living with partner and baby. And over the course of the last few years, we developed an empirically supported measure of paternal involvement with infants called the Pee-wees, because we're grown-ups and we like to have fun. And so we've been looking at factors that promote involvement in terms of dad's mental health and relationship with partner. As a counseling psychologist, I've really been interested in these things from a cultural context. And so we've been exploring what involvement looks like across cultures. We actually just recently validated the Peewees for Latino dads. And I think one of the things that's kind of unique about our approach is because counseling psychology emphasizes cultural context and strengths, we tend to focus more on what's right with dad. And so as Nia mentioned, the stigma around being a young parent, I think there's also, the stereotype of the bumbling dad. And we talk a lot more about toxic masculinity than we do about things like generative fatherhood. And so we saw this recently. We did a content analysis of Psychology and Masculinities, the biggest journal in our field, and found that over 20 years, only 15% of the articles have had a positive focus. So we know a lot about toxic masculinity, but we don't know a whole lot about what's right with dad. So my approach to masculinities is really that social construction, recognizing culture and environment, but also recognizing that men make choices. To kind of do this cost benefits analysis of if I show this side of myself, what kind of feedback am I going to get? Will that be reinforced or will I be ashamed for that? So as we think about how fatherhood's evolved, I think it's important to know that measurement and the work that we do as a field really hasn't caught up to modern fatherhood. And so we kind of think about dad 1.0 as the dad bringing home the bacon, working outside the home to be the provider. And this is a dated stereotype that's based in white middle-class 1950s America. But the reality is that the way we measure paternal involvement at this point is still largely based on financial contribution, time spent with children, and mom self-report. So we don't really have a whole lot of feedback from dad about their subjective experience as a father. We also see that masculine norm endorsement really restricts how involved the dad is. And so there are certain situations when it's okay to show affection, to express emotion, this idea that you're restricted and you need to demonstrate masculinity, you need to achieve status, you need to be able to provide for your family. I think it's summed up well by this picture. You'll notice that the dad is actually showing affection to his son, but he's doing that while giving him a gun. So it balances out. And so, we still see this idea that, rigid adherence to masculine norms means I'm not as open and nurturing in my children. So Dad 2.0 looks a little different. And we've seen generational shifts in fatherhood over the last few decades. This move toward generative fatherhood, this idea that your job is not just to be a provider, it's to support and guide the next generation. So in this role, you become a co-parent. So you have equal responsibility for things like housework and parenting. And we see that, especially in studies of stay-at-home dads, for example, there's much less endorsement of those rigid traditional masculine norms. So Dad 2.0 tends to be more nurturing and more emotionally available to his partner and his baby. So the essential fatherhood hypothesis was thrown out the window about 20 years ago, this idea that dad is necessary for child outcomes. So I'm not going to go there, but what I would say is that we have a lot of research indicating that having dad involved has benefits for everyone. And so in terms of child outcomes, you'll see here that there are a lot of issues here related to school readiness, emotional regulation, mental health, and attachment for kids when their dad is involved. In terms of outcomes for dads, we tend to see that dads who are more involved with their kids have less depression and anxiety, less substance use. They report more parenting satisfaction when they're equal co-parents than when they feel like they're just the provider that's not as involved in the day-to-day. And they also report more satisfaction with their partners. But there's also been some interesting research on what this is like for their partners, especially among heterosexual couples. There's been this finding that when women perceive that they have an equal co-parent, they report fewer mental health issues, and they report that they are more confident in their parenting, feeling better in their relationships, more responsive to their kids. So really this whole idea of promoting healthier masculinity means benefits for the man, his family, and his community. So another area that I've really been focused on in the last few years has been around paternal mental health. As a depression researcher, it seemed like a logical step for me to make. And one of the things we're finding is that among new dads, especially for dads whose own fathers were more traditional, there's a lot of uncertainty that comes with that role change. And so we know for many new parents, it's a time of uncertainty and stress. But when you don't have that model to look toward for what co-parenting looks like, or what Dad 2.0 looks like, it can be a particular challenge. And so many of these dads, despite a really strong desire to be involved, report not knowing what that should look like or being really overwhelmed. We do occasionally see frustration toward baby and resentment of partner for changes in relational status, but it's actually pretty low frequency in the data we're looking at. So we actually measure frustration and resentment with the peewees now. We see it among a very low percentage of dads. Typically dads that have higher levels of gender role conflict or endorse more of the traditional masculine ideology have a stronger impact on those disruptions. But I think some of the most important stuff to come out of this research is that between 10 and 20% of new dads experience perinatal depression or anxiety. So either before baby is born or right after, reporting clinically significant depression and anxiety. And if your partner has been diagnosed with postpartum depression, that risk increases by about 50%. And so I think this is incredibly relevant because most times, whether it be in the hospital or at the OB's office, we're assessing mom for postpartum, but we're not asking those questions to dad. And so there's some amazing work going on out in California. There's actually a program UCLA runs where they're going and doing in-home support for dad and baby when mom has been hospitalized with postpartum depression. And so it's a mix of mental health and building parenting self-efficacy. And so really what we've advocated for is more of a whole family approach to parental mental health. And so making sure that we're paying attention to dad's mental health during this transition as well, so that he can be the supportive co-parent and be available to his baby. We're also looking a little bit at perceptions of paternal mental health. This idea that, can men even have postpartum or perinatal anxiety or depression? Are they entitled to that? What are men and women's perceptions of men who report these things? Because we're seeing initially that in general, men report a lot more self-shame when they're depressed, but we're seeing that amplified above and beyond when it's perinatal related mental health issues. So there's a lot more shame and stigma that comes with that. So we know that dads have the potential to be very involved co-parents, but we also know that there's some barriers to that. So on the left, I've got some barriers specifically related to being a new dad or to the relationship with partner. And on the right are some issues just related to masculinity. I think I'll start with those actually. So for men who endorse pretty traditional masculine norms, we do see that the idea of experiencing depression is inconsistent with masculine ideology. And so it's not socially acceptable to feel those things. It's more socially acceptable to feel things like anger or to become more disconnected. And we see the things like increased demand for autonomy, increased substance use, social isolation, throwing yourself into work, more as ways to save face while experiencing traditional symptoms of depression. Another piece of that, as I've mentioned, is the self-stigma. And so men internalize stigma about depression at higher rates than women because it's a violation of a social norm for many men to experience these things, let alone to seek help. So really this double jeopardy occurs because there's this pressure to conform to gender expectations for traditional masculinity that mean that I should either kind of bury this stuff deep inside and ignore it, or if I do decide to seek help, I'm violating a norm by feeling something I shouldn't feel and telling someone else about it. The encouraging news on that front is that we do see that men tend to be more comfortable disclosing these kinds of things to their partners than they would be to clinicians. So, building up that relationship between the partners and increasing communication and openness and honesty around mental health, reducing that stigma around perinatal mental health especially can be beneficial for these dads. I mentioned socialization earlier, this idea that having that social model to look to for what engaged fatherhood looks like is really critical. And so depending on how your parents looked, that's going to influence how you parent, of course. And so sometimes it's kind of recreating those norms for what we think involved parenting is. But there's also, I think the programmatic issues that Nia raised earlier are important, because there's, among some there's zero-sum mentality. So by making room to have conversations about dad, we're not taking away the attention and the programming from mom. And so as we think about this whole family approach, it's about building resources for everyone rather than taking resources away from someone and giving them, from mom, giving them to dad. And so that's where groups like Postpartum Support International, for example, have started to build in more programming for fathers while continuing to grow for moms. So we have to avoid that idea of zero sum. So if we focus more on dad, we're neglecting mom. And that's really not what we're talking about here. I think the efficacy beliefs is another big piece of this. So we're seeing that a lot of our dads report pretty low parenting self-efficacy, just in terms of general skills for parenting, especially if they haven't had those models, like what their own dads look like. And so there are programs now that are starting to provide basic training for new dads on things like diapering, bathing, swaddling, communicating with your partner through that transition. And so skill building, I think, is something that's really critical. And it's actually kind of where we're headed now, is developing interventions for new fathers to try to help boost that parenting self-efficacy. So related to that, and probably one of the more controversial areas of the research has been around this idea of maternal gatekeeping. And maternal gatekeeping is this phenomenon where dad might want to be more involved, but he's not allowed to be, out of concern that he'll mess up. So, oftentimes that stems from the other partner's anxiety. Like, it's easier to just kind of manage everything on your own so it gets done right. And so negotiating co-parenting is a critical aspect of that, processing what you want both partners' roles to look like and taking care of the child is really critical, and navigating any anxiety you might have about things like, leaving the house and leaving the baby at home with your partner. Custody arrangements, Nia, I think, spoke brilliantly to the issues with many of the existing programs that we have that really cater more to residential fathers. And there's very little out there for non-residential or non-traditional family constellations. And, continuing issues with work-life balance. And so this is where issues like, paternal leave policy really come into play. So I would end by saying it's not all doom and gloom. We know a lot about how to boost involvement. And so, some of the interesting things we're finding is that social support is a huge factor. And so many of the new dads that we've worked with feel pretty isolated. They don't really, traditional masculine ideology says you shouldn't ask for help. But we're finding that when we can provide more informal supports, like connecting dads with other fathers by helping them to maintain their social connections outside of their relationship with partner and baby, it goes a long way. They have that outlet to seek support from. We also see that dads prefer to get this support from other fathers, so someone else they can consult with and compare experiences. And for some reason, the idea of kind of on-the-fly support and being able to just acknowledge that sometimes we're winging it rather than having a really detailed plan, like we thought 5 steps ahead, without feeling shame around that, tends to be helpful. But the biggest things I've seen have been rebuilding co-parenting relationships. So co-parenting relationships and parenting self-efficacy are the big two. As we've looked at how do we increase involvement over the last 5 years, those are the two biggest predictors of involvement with baby, at least, has been how do we rebuild or establish co-parenting relationships between both partners where there's role distribution, everyone feels safe to acknowledge when they don't know, or to try things and fail, and then also just kind of skill building through that self-efficacy. And that's especially challenging for men whose own fathers were not very involved. So we've also seen that we can build this self-efficacy through goal-directed thinking and hope. As a counseling psychologist, I'm really big on this. So we actually just recently developed a Hope for Parenting scale, and we're developing these interventions to boost hope for parenting. And so I guess I would leave you with that. Building self-efficacy and co-parenting are critical, and expanding the way that we screen for perinatal mental health to include fathers.
I just want to highlight what you have at the very end of the slide, paternal leave policies. And I'm thinking there are paternal leave policies, and more fathers are taking parental leaves. Although I suspect this is only accessible for certain classes, social economics classes. I'm just suspecting. I'm thinking of Google, for example, as an employer, and who works for Google and who does not. That interesting. So we already have questions, and if you can, I'm going to turn to the audience right now, and it's time for you to send me your questions if you have any. We have one question already. How might we work to affect policy change as it relates to co-parenting for non-legally committed partners and their families?
I love that question. Although I'm going to start by saying I don't 100% have the answer, but it is the question. I've actually gotten to be involved with a partner organization on some work that they're doing with young parents and building an advocacy network of young parents. And like, this is their top priority, that we have, that they want to see better support for co-parenting and sort of the removal of the barriers for co-parenting. And we will be working over the next couple of years, to figure out exactly what that means. But a few of the things that I can sort of say off the top of my head are really needing to think about our child support and child support enforcement policy as a place for change. And just sort of the ways that sets up particularly families of color for bad outcomes. Not making benefits contingent on seeking child support from a father or naming a father, I think is really important. And again, thinking about some of this stuff, there's sort of what's in policy, and then there's the implementation practices that flows from policy. So it's sort of like sometimes people assume the barrier is in the law or is in the regulation or is in the funding stream. And it's actually just the way that people are implementing it. So really interrogating in our different programs, does it have to be this way? Do we have to have single gender housing? Do we have to have mother only programs? Can we think about exceptions for, if you have a family program, but it's only up to 25, but the dad is 26, can we think about an exception so that the mother and father can be together in the same housing? There's a quote that I didn't share from a young woman in Texas who talked about the father of my child literally had to be on the street for me to be able to get into housing. And it just, those are not the types of decisions that young people should be having to make. It shouldn't be a choice between getting benefits and support and housing and different things that you need for your child and having your child's father or co-parent involved in the child's life. So those are sort of some beginnings, but I would also say, as Rachel Maddow says, watch this space, because it's definitely something that we're going to be thinking about over the next year or so.
Another question, is there any data on postpartum depression among men as a function of employment, income, race, age, or other demographics?
It's a really good question. And there are actually almost 100 studies now that have explored this phenomenon around the world. And, we see that employment specifically tends to be a big one. So for men that are underemployed or unemployed, higher risk for perinatal depression and anxiety, but also for men who feel real struggles with that work and home balance. And so there's some emerging research about men who have the ability to take paternal leave but feel pressured not to, in the same way that women often feel pressured not to utilize their full maternity leave, reporting higher levels of depression and anxiety because of feeling kind of stuck. We do see that the experience of perinatal depression and anxiety tends to affect all types of men with regard to SES and age, sexual orientation, and race. There have been some pretty large national samples that have started to look at this around the United States. And so no one seems to be immune from it, but what we do see is that there's usually a real lack of accessibility to services for those that are not real high SES. So it's often underdiagnosed and just completely ignored.
And Corinne, I just want to add to your point, sorry, about paid leave, and particularly when you're talking about paid leave for folks in low wage work, which is again where a lot of young parents are if they're working. So again, just first of all, in many of those jobs, the leave doesn't exist, or you can't actually take it. There was a young woman that we spoke with in Colorado who went back to work after 2 weeks because it was that or lose her job. And then ended up having medical complications as a result of that, and then ultimately losing her job anyway, because then she couldn't work for 6 months or something like that, because she went back to work before her body was fully healed. And I think so if I were going to talk about sort of another set of policies that maybe psychologists aren't always thinking about, but that are really important, are these paid leave policies, particularly for people who are in low wage jobs, because they may not have it, or they can't afford to take it because it's not 100% wage replacement. And, you know, when you're already living on such a tight budget, not working is just not an option.
Absolutely. And I think actually New Jersey is a model for how this might be done in a different way. So in the state of New Jersey, all new parents have access to paid leave through the state as part of disability. And so, you know, new parents can file for short-term disability, and they don't have to do it at the same time even. So you could have one partner go and then go back to work and the other partner start after that. And it's paid for through your taxes in the same way anything else would. And I think it comes up to about $6 a month for most families that they pay into this disability fund that they could then draw upon as new parents. There's still a lot of barriers to that. Like, for example, when I lived in New Jersey, I was on a 9-month contract, so I didn't qualify. But for many families, that's the only real option for paid leave that they have.
DC has a similar program that just, they started deducting the taxes a year ago. So just as of this past June, I think people could start to take the leave. And there are states and localities around the country doing these things. But again, you can have such a different experience just depending on where you live in the country because of how patchwork our policies are. And it would be really great to see some of this stuff implemented at the federal level so that it no longer matters where you live.
Absolutely.
I have more questions for you. I work at a university counseling center. We know there are parents who are attending the university, and those parents could benefit from services, but they do not typically reach out to the office. Based on your research, do you have recommendations for outreach efforts to student parents or ways that we can structure our clinical system to better support them?
I do, and this is a theme in talking with young people broadly, particularly young people, again, from marginalized communities, from low-income communities. And this is sort of a whole different conversation, but there's a lot of distrust of traditional mental health services in low-income communities and amongst people of color, and deserved mistrust, quite frankly, based on the history of some of these systems with these communities. I think the biggest thing across the board, which ties into something that Brian said in terms of dads wanting to talk to other dads, young people want to talk to other young people, parents want to talk to other parents. So to the extent that you can engage young parents in bringing other young parents, in leading the conversations with other young parents as sort of peer supports, that is going to be your best strategy, I think, for getting young parents to take up the service. But on the flip side, also doing some real self-reflection and self-interrogation about why it is that young people are not accessing that service. Are your hours friendly to parents? Is there somewhere for their child to be while they have the appointment? You know, are there costs involved? Do they need additional transportation? Do they have a job they're trying to get to right after class so that they can't sort of do other things? And then what can you do, again, to make the environment more friendly to young people or to young parents?
Yes, to all of that. So, you know, having childcare available or providing flexibility in delivery. For example, in the time of COVID, doing teletherapy. I mean, it's hard enough. I mean, it would be a real privilege to be able to take an hour away from your partner and baby to go to therapy, for example. I mean, it's almost impossible for working parents, especially those that are going to school. And so changing the way we offer those services in, in the evenings or on the weekends, online instead of in person, helps with accessibility in a way that most counseling centers don't offer on campuses.
Yeah, it's been in our policy work, young people wanted telehealth before the pandemic happened, and it's been fortunate that the pandemic has now opened up possibilities policy-wise for young people to get something that they were saying they wanted long before we got to this moment. So yeah, that telehealth piece is key. And also not just telehealth sort of face-to-face, but being able to do app-based and text-based services is something young people really appreciate.
Another question about race. Manhood for Black men in particular is important and defined relationally, with their manhood being directly related to their beliefs of self-efficacy in a range of domains, including marriage and fatherhood. Is manhood, Black masculinity specifically a focus of any of the interventions directed at fathers?
Yes. So what's interesting is, I think for Black fathers, there's a particular challenge related to having multiple models of fatherhood, and in terms of identity development, knowing which model to shoot for. The bigger thing to me is that the research shows pretty consistently that that Latino men, Black men, Asian American men all experience gender role conflict in a very similar way to white men. And so we know that this conflict between traditional masculinity and wanting to do things your own way exists for almost all men in the United States. But we also see that programs that are built around understanding the unique challenges for Black men, for example, institutionalized racism, access to services, things like that, tend to be much more effective. And so there are programs that are designed in ways to be more accessible, to be more culturally competent, because really a one-size-fits-all intervention here just doesn't work.
And I think we have to take as a baseline that Black fathers are very involved fathers. There's
Absolutely.
all kinds of data on that, particularly young Black fathers.
Yep.
Young fathers of color are highly involved fathers. And it may not look the way it looked in the 1950s, but that's why I say the young people are ahead of us, right? They're working out the new models of fatherhood and what works. And what is harmful is these ideas, again, that we carry of deadbeat dads or dads that don't care, that don't want to be involved in their children's life, when the reality is it's just not who most young fathers are. And so we have to really, again, start, check our assumptions and make sure that we are not building those kinds of assumptions into our interventions.
And our research over the last few years would show that. So we've got nationally representative samples that we've collected now twice, and we see that actually dads of color are more involved than the white dads in our samples. And so I think that's the challenge of some of the existing programming, is that they're built based upon stereotype, and they're not as focused on individual context. But I think you're totally right that the young dads especially are way ahead of the game when it comes to these things.
Another question, what can we do to have psychologists providing mental health services to low-income minority parents? We see mostly masters in social work, LPCs doing that. Does the division have, well, it's our division, is there any policy recommendation guidance for that to happen?
So, like I said, on my end, one of the biggest barriers there are many barriers to folks accessing mental health services, but cost is far and away the biggest one. And there are all kinds of issues with, on the one hand, Medicaid is actually fairly generous around pregnancy and birth. So you will find actually more young mothers will have Medicaid coverage than young adults in general. The flip side of that is that young men are the least likely to have Medicaid coverage of anybody, because the program is least generous around the country with single working young adults. Although again, there is variability. A lot of those decisions are made at the state level, and some states are more generous than others. I know that the reimbursement rates are not what anybody likes. And there are a lot of issues with about a sustainable business model and Medicaid payment. And we can all become advocates around that and advocate for those higher reimbursement rates. But in the meantime, if you do not accept Medicaid in your practice, it is not accessible to low-income parents.
Unless we value volunteering in the community, I mean, there's also pro bono services that we can deliver, and some of us do that type of work as well, not only being in private practice, but also being in the community and being involved in programs on a pro bono basis.
And I think that's an important consideration. I mean, I'm not in private practice, I'm at the university, but we have community partnerships where we actually help develop programs that are free of charge. So like the United Way of Douglas County, where our university has a fatherhood group for 0 to 18. And so consultation with them has been really critical. You know, I think another piece of this, and I know it varies based upon discipline, but you know, I think expanding multicultural training in psychology to really focus a lot more on socioeconomic status and race, but also recognizing masculinity as an aspect of multicultural competence. So, you know, taking more time to understand psychology of gender in our training is, I think, really critical to being able to adequately serve many of these populations.
And thinking about partnerships as well, how can you partner with those MSWs and LPCs or with sort of other community-based programs to do that work? Because again, it's another conversation for another day, but there's, you know, a lot of history between communities of color and the mental health system that impacts whether or not folks want to access services, can access services, et cetera. And again, given the moment that we're all living right now, everybody really needs to do self-reflection, interrogation around sort of what elements of my practice might be that I'm not thinking about might be hindering access or not making people feel welcome or safe or included here.
So maybe the last question for tonight. So I'm not sure I understand fully the question, so maybe the person who asked it can unmute themselves, but is the rate of paternity fraud, the intentional misidentifying of the father, between 10-20 in the general population? Do Black fathers suffer at higher rates? So I know it's Robert. I don't know if you can unmute yourself, and I don't know if you understand the question, or if you. Robert? I may have lost Robert.
Paternity fraud is not highly recognized anywhere, but it would seem that if anyone was subject to it, that the Black community may be more subject to it than elsewhere, meaning that children don't have don't have their heritage correctly, either their medical or other heritage. That's what the question was from.
Okay, and so this is what I want to say about that. I would want to interrogate even the framing of that question as paternity fraud, which actually sort of criminalizes people maybe, I guess, not putting a father's name on a birth certificate or not wanting to name a father as they're trying to access public benefits or different things like that. Let's flip that for a minute and think about what is it about our systems that makes some families feel like they cannot name the father, that they want to name a different father so that they can, again, like if you are in a new relationship and now have a stepfather involved, how are our systems allowing for that and supporting the co-parenting of a stepfather and a mother who, you know, for whatever reason? I think I'm troubled by sort of framing it in that way and really want us to just operate from a place of understanding that most fathers want to be involved in their children's lives. Most fathers are involved in their children's lives. And there's a whole history of systemic reasons why somebody might not want to put that person's name on a birth certificate. But even using that language of paternity fraud criminalizes behavior that doesn't have to be viewed that way.
Thank you, everyone. Now it's 9 o'clock. Thank you for participating. It was a beautiful webinar in my eyes. I really learned a lot from the two of you, and I'm so glad I invited you to be on this panel. I look forward to learning more from both of you, and I hope that everyone got something out of the webinar. Remember, everyone, if you would like to get a CE, to complete Linda Burcross sent us a link. Make sure to click on the link and complete the evaluation, and Linda will send you the certificate after tonight. Thank you very much.
Thanks so much for having me. Have a good night, everybody.
Have a good night.
Corinne, I am so sorry I sent it out wrong.
That's okay.
Only one person